Well, hello everyone. My name is Brianna, and I'm here with Macy and Alka. And as Dr. Baldwin already stated, we're going to be talking about how fitness is important as we get older. So as we age, it's very important for all of us to participate in regular physical activity. Exercising regularly can provide many benefits, such as preventing or delaying the onset of various health conditions. It's also making sure that our muscles continue to grow stronger, which helps us stay mobile and independent as we age. So for adults age 65 and older, the CDC typically recommends that we exercise at least 150 minutes a week with moderate intensity activity or 75 minutes of vigorous physical activity. They also recommend that we do at least 2 days a week of muscle strengthening activities and do activities that improve our balance for about 3 days out of the week.
So while it's important to engage in physical activity, it's also important to learn how to measure the physical activity. So there are two ways. The first way I'm going to talk about is how to tell if it's like low, moderate, or high intensity exercise. So for example, during low intensity activities, you'll know if it's like a low intensity activity, if you can talk and have a conversation during your activity. And if it's a moderate activity, you'll be able to have a simple conversation, but you'll be able to take like slower, quicker breaths. And then also if you're performing like more vigorous, more challenging physical activity, your breathing will be very deep and rapid, and it'll be very hard for you to hold a conversation as well. So the second way I want to talk about how to measure your exercise intensity level is monitoring your heart rate. There are several apps on the handout that can help you measure your heart rate, and most of this will be measured through like a mobile device or like an Apple Watch. And then the higher the intensity of the workout is, the higher your heart rate will be. It's also important to know your own limits and not to overwork yourself and to do exercises that are for your body composition.
So nextly, we'll go into a few different disease states where fitness will play a part. The next thing we're going to talk about is obesity. So obesity is typically defined as having a weight higher than what's considered healthy for your height. We typically measure this through BMI or body mass index. So having a BMI of 25 to 30 is considered overweight, 30 and higher is considered obese, and then having a BMI greater than 40 is morbid obesity. So people who have obesity have a higher risk of developing high blood pressure, high cholesterol, type 2 diabetes, asthma, sleep apnea, joint problems, and also gallstones. The next disease state we're going to cover is hyperlipidemia or high cholesterol. So the American Heart Association states that living a sedentary lifestyle or just a lifestyle where we're not very active lowers the amount of good cholesterol we have present in our body. So when we go to our doctor and have our cholesterol checked, they do a basic metabolic panel, and that pretty much just checks our total cholesterol, our HDL, which is our good cholesterol, our LDL, which is our bad cholesterol, and triglycerides. And triglycerides are just a type of fat that we have in our body that stores our energy from our diet. So having an overall lower amount of HDL present in the body lowers the amount of good cholesterol that we have available to remove the bad cholesterol from our arteries. So being overweight or obese can also significantly raise the level of bad cholesterol in the arteries. So pretty much what we can do to kind of combat this is just performing resistant and weight-bearing exercises. That'll pretty much just increase our muscle mass and help us develop more good cholesterol in our bodies. So if you're currently taking a statin medication for high cholesterol, you want to start with a lower intensity and a lower amount of exercise just because of the muscle pains you may experience on that medication.
Oh yeah, you're right. Yeah. I'm telling you, I get cramps in my thighs because I do take a statin. I'll be saying, oh my God, them things hurt. But look, let me ask you one question. I'm sorry if it's okay. Let me just ask you one question, and that is, I took my blood pressure the other day. My top number was high, but my bottom number was okay. What is that? Because you said something about, well, I don't know, that's good cholesterol and bad cholesterol. If your top number is high, what does that mean?
That's blood pressure, and we're getting to that.
Oh, okay.
Right?
Okay, sorry.
So if we don't answer, we'll try to get it at the end.
Okay, gotcha.
All right, the next condition we're going to talk about is diabetes. According to the CDC, exercise and physical activity is a key way for seniors with diabetes to maintain their blood sugar levels. Additionally, incorporating physical activity into one's daily life can help to benefit one's diabetes by helping their body to become more sensitive to the insulin in terms of being able to use the sugar in their body for energy, which leads to appropriate diabetes management. Exercise serves as an additional means for maintaining or lowering one's blood sugar levels while taking their appropriately prescribed medication regimen in order to prevent unwanted progression of heart disease and nerve damage. When first starting to exercise, a few things to keep in mind for a patient with diabetes is wearing appropriate shoes that have good traction, good support, wearing diabetic socks. These socks are here to help with moisture, and they also help as far as putting less pressure on the foot, and also participating in regular foot care. Another thing to keep in mind with diabetes is that you might need to monitor your blood sugar more often before and after exercising, as well as adjusting your eating habits to compensate for the calories that you're burning, and also possible medication adjustments. So if you're planning to increase your exercise and you have diabetes, it's just a good thing to discuss with your doctor before starting. The next condition is hypertension. So according to the American Heart Association, physical activity not only lowers one's blood pressure, but it can also help to strengthen one's heart, help to maintain a healthy weight, and contribute to one's overall mental well-being. Most importantly, regular exercise works to strengthen our heart, which allows for the heart to be able to pump blood throughout the body and not place as much pressure on the arteries. So it is important to note that exercise can lower your blood pressure within about 1 to 3 months. And in addition to this, it's good to note that after you get finished exercising, allow for about 1 to 2 hours for your blood pressure to come back down to a normal rate before you try and check it. If you're taking a beta blocker for either your possible blood pressure or another heart condition, such as metoprolol, carvedilol, bisoprolol, propranolol, these drugs can have the possibility of causing syncope or hypotension. So a few symptoms or common signs of when syncope is occurring to be aware of is dizziness and nausea. Hypotension, this is simply a quick drop in your blood pressure, which can be experienced while exercising. And a few things just to note with that is that some symptoms are dizziness, nausea, and blurred vision. And if you experience any of these, the best thing to do is just take a seat from exercise and allow your blood pressure to stabilize, and if you need to, seek extra support.
So the next disease state we'll be covering is anxiety. For mental health, I feel like fitness is not that much emphasized, so I thought it'd be important to talk about anxiety and fitness. So according to the American Psychological Association, anxiety is an emotion characterized by feelings of tension, worried thoughts, and physical changes such as an increased blood pressure. People with anxiety also have intrusive thoughts, and they tend to avoid any triggering situations. Exercise helps with combating these thoughts and easing the mind. So exercise with anxiety releases endorphins and also reduces a stress hormone called cortisol within your body, and can also improve your self-confidence and mood. Two main forms of exercise with anxiety are yoga and Tai Chi. These help with relaxation, rhythmic breathing, and meditation. And then the last disease state we'll be covering is osteoporosis. And this is a bone disease that occurs over time in which your bones become thinner and weaker. And the best exercise for osteoporosis is resistance exercises because they help strengthen the muscle and build bone. So examples of these resistance exercises include walking with a backpack on your back, going for a walk with a heavy water bottle in your hand, and then adding a weight to a walker. When you're walking with a walker, that's a great way to improve weight and build resistance over time. And then non-traditional exercises include pushing a lawnmower, gardening, and step aerobics are great ways to increase resistance and osteoporosis as well. And then exercising to osteoporosis is also great to just improve balance overall and reduce the rate of bone loss and fracture. And then at this specific senior living community, there's a Walk with Ease class, which is a great class to attend for osteoporosis because walking will help to keep your bones strong and reduce the risk of developing a bone fracture in the future.
Okay, so now you may be thinking, well, how can I get started? So now we're going to discuss a few things to maintain successful exercise habits. So step one is to determine what type of exercise may benefit you the most. And when we talk about types of exercise, they can be broken down into aerobic exercise. And what aerobic means is this exercise is going to use oxygen, which can further provide cardiovascular benefits. And some examples of cardio or aerobic exercise are to participate in walking, biking, whether that be a stationary bike or a recumbent bike, water aerobics or dancing, whatever you may like. These are all forms of aerobic exercise which can help you. Also, weight-bearing exercises can help to improve your bone strength, and they can be completed using some of the previously mentioned exercises also. And also we have resistance training. And what resistance training is, it's a form of strength training that involves increasing your muscle strength and endurance in both your legs, your arms, your abdomen, which are all used on a daily basis. And some typical exercises that you can do with these are to use light weights. They don't have to be what you're thinking about as dumbbells. You can use something as simple as a water bottle or a can of vegetables, just to provide a little bit of extra weight. You can also use resistance bands or simply use body weight exercises. Okay, step two is you want to set individualized goals for yourself that are realistically achievable, whether it be on a weekly basis or a monthly basis, whichever you prefer. And then step three, you always want to start exercising slowly, and what this does is it allows your body to accept the change so that you don't experience an unwanted injury. And then step four, always wear appropriate clothing and shoes that allows you to freely move but also provide you with support. And step five, always remember to stay hydrated, especially since the summer months are coming up. You don't want to dehydrate yourself, and you want to maintain adequate nutrition, so keep your body fueled as you're burning these extra calories. And then lastly, I want to just let you know that it takes about a month for a habit to form, so if you start now, you'll be on your way to maintaining healthy exercise habits before you know it.
Any questions besides the two that I know of? So I was asked prior to the presentation, or slightly whispered during, is what causes high blood pressure. And what causes high blood pressure is actually, could be a composite of things. It could be genetics, can't fix that. It could be what you ate for 20, 30, 40, 50, 60 years, having an impact on your arteries. Your arteries, a good way to think about them sometimes is they are very similar to a garden hose. You know, several of you have gotten garden hoses. What happens if you leave that garden hose outside all the time in the weather? They get old. You bend them and they make noise. They get stiff. They don't move as well. That same thing happens to your arteries. We get normal buildup with cholesterol as it happens. So that can cause it. And some of it is just plain race. You have to, some races have a higher likelihood of having high blood pressure, and some of that stuff you just can't change. The other thing is, what's the difference between the high and the top number? One is when your heart squeezes, top number, and the other is the bottom number is when your heart is relaxed and filling. And it's not uncommon, by the way, to have one elevated and one normal as you get older. It's very common.
Okay.
All right. Any other questions, comments, thoughts? Thank y'all for your attention.